As a brain doctor, I want to share with you a fact that many people overlook. Stroke is one of the most dangerous medical emergencies we face, yet it often does not strike without warning. In some cases, your body begins to send subtle signals days or even a full week before the major event happens. These warning signs are easy to dismiss as fatigue, stress, or normal aging, but ignoring them can mean the difference between recovery and lifelong disability. Stroke occurs when the blood supply to the brain is blocked by a clot or when a vessel ruptures and bleeds. Within minutes, brain cells start to die, and every minute lost increases the damage. Survivors often live with paralysis, speech problems, or memory loss, making stroke not only a leading cause of death, but also one of the top causes of permanent disability. The hopeful truth is that if you recognize the early signs, you can seek urgent medical care in the golden window of time when treatment is most effective. Symptoms such as sudden dizziness, loss of balance, blurred vision, unusual headache, weakness in an arm or leg, or slurred speech should never be ignored, even if they last only a few minutes and then go away. These could be the brain's way of warning you that a major stroke is coming soon. In this video, I will walk you through the early warning signs that can appear up to 1 week before a stroke, the reasons they happen, and what immediate steps you should take if you notice them. Before we begin, I want to ask you something important. Have you or someone you know ever experienced sudden dizziness, numbness, or strange headaches that vanish quickly? Share your experience in the comments, because your story may help others recognize the danger and act before it is too late. 1. Why early warning signs matter. When it comes to stroke, time is the most valuable currency you have. Every second that blood flow to the brain is interrupted, millions of brain cells are lost. This is why doctors often speak about the golden window. The first few hours after symptoms appear, when medical treatment can dissolve clots, control bleeding, and save vital brain tissue. But what many people do not realize is that the brain often gives early signals, sometimes a week before a full stroke occurs. These are not random aches or simple fatigue. They are small warnings that circulation in the brain is unstable. Recognizing them could give you precious days to act before permanent damage sets in. A common way the brain alerts you is through what is known as a transient ischemic attack, often called a mini stroke. During these episodes, blood flow to part of the brain is briefly reduced, causing symptoms like sudden dizziness, blurred vision, slurred speech, or weakness in an arm or leg. The frightening part is that these symptoms often last only minutes before disappearing completely. Many people dismiss them, thinking the problem has passed. But in reality, a transient ischemic attack is one of the clearest signs that a major stroke may be imminent. Research shows that the risk of having a full stroke is highest in the days and weeks following such an event. The importance of noticing these early warnings cannot be overstated. If you respond quickly and seek medical care, doctors can investigate the cause using tools like brain scans and blood tests. They may discover high blood pressure, blocked arteries, or heart rhythm problems that need immediate treatment. Interventions such as medication to thin the blood, procedures to remove blockages, or adjustments in lifestyle and medication can all be implemented before a full stroke occurs. Acting at this stage does not just lower your risk. It can prevent the catastrophic loss of speech, memory, and independence that comes when a stroke is allowed to strike without resistance. Another reason early recognition matters is that symptoms are often subtle and vary between individuals. One person may feel sudden confusion or memory lapses. Another may have brief vision loss, while someone else may notice numbness in the hand or face that comes and goes. By knowing that these small changes can represent a serious threat, you train yourself and your loved ones to treat them as urgent. Every minute matters. But if you recognize these patterns a week before the main event, you can save not only minutes, but days of warning. Giving doctors the opportunity to protect your brain. Stroke is devastating not only because of its suddenness, but because so many people ignore the red flags. Early warning signs matter because they are the body's final alarm before disaster. Treat them as seriously as you would chest pain or shortness of breath. If you listen carefully, your brain may already be telling you that it needs help, and listening could be the choice that saves your life. 2. The main causes behind these warnings. To understand why the body sometimes gives early warnings a week before a stroke, you must first understand the underlying causes that place stress on the brain circulation. Stroke does not simply appear without reason. It is the result of years of silent changes inside the blood vessels, the heart, and the body's metabolism. These changes eventually reach a point where the brain can no longer receive steady blood flow. And that is when the first warning signs begin to surface. The most powerful and common cause is high blood pressure. When pressure inside the arteries remains elevated for years, the vessel walls weaken and stiffen. This constant strain makes them more likely to rupture or to become blocked by a clot. High blood pressure is often called the silent killer because most people feel perfectly fine until it is too late. Yet it is responsible for more strokes worldwide than any other single factor. Closely linked is high cholesterol, which allows fatty deposits to build up along the vessel walls. Over time, these plaques narrow the arteries that feed the brain. A small piece of plaque can break loose and form a clot, temporarily blocking blood flow and creating the brief symptoms known as transient ischemic attacks. Diabetes adds another layer of risk by damaging small blood vessels and altering the way the body processes sugar and fat. These changes make clots more likely and healing more difficult. Heart disease, especially irregular rhythms such as atrial fibrillation, is another major culprit. When the heart beats unevenly, blood can pool and clot inside the heart chambers. These clots can travel upward into the brain, blocking arteries suddenly and causing either a mini stroke or a full stroke. Lifestyle choices amplify these medical risks. Smoking is especially destructive. Every puff delivers toxins that scar the vessel walls, promote clotting, and deprive the brain of oxygen. Smokers are known to have double the risk of stroke compared to non-smokers. And even secondhand smoke damages blood vessels. Excessive alcohol weakens the heart muscle and raises blood pressure, making vessels more fragile. A sedentary lifestyle also contributes by allowing weight to rise, blood pressure to increase, and circulation to stagnate. Inactivity gradually erodes the resilience of the cardiovascular system. Age and family history cannot be overlooked. After the age of 55, stroke risk doubles with each decade, and those with parents or siblings who suffered stroke carry a higher chance themselves. Yet even here, early warning signs serve as an opportunity. Genetics may load the gun, but lifestyle often pulls the trigger. Recognizing these risks early means you can disarm the danger before it fires. The reason these underlying causes produce warnings is that they do not suddenly appear. They build slowly until one day the brain circulation is compromised enough to cause symptoms like dizziness, blurred vision, or temporary weakness. These are not coincidences. They are the result of blood struggling to reach vital brain tissue. By identifying the causes behind the warnings, you can see that stroke is not random. It is predictable, preventable, and manageable when treated with urgency. 3. The warning signs to watch for. The most dangerous mistake people make about stroke is believing that it happens without warning. In reality, the brain often sends out clear signals that something is wrong. These signs may appear days or even a week before the main event. They may be brief, they may vanish quickly, but they should never be ignored. Each of them represents a temporary disruption in blood flow to the brain, and together they form a map pointing directly toward the risk of stroke. One of the most common warnings is sudden dizziness or loss of balance. If you find yourself feeling unsteady, unable to walk in a straight line, or suddenly overwhelmed by vertigo, this may not simply be fatigue or inner ear trouble. It may reflect a short interruption in blood reaching the brain regions that control coordination. Another frequent sign is sudden vision changes. Blurred vision, double vision, or temporary blindness in one or both eyes can all indicate that circulation to the visual centers of the brain is being compromised. This symptom may last only minutes, but it is one of the clearest alarms that a stroke could be imminent. Memory problems are also important. Temporary confusion, difficulty recalling recent events, or feeling mentally foggy can occur when blood supply to areas of the brain that manage memory is reduced. Many people dismiss these moments as normal aging, but they may represent a much more urgent problem. Severe headaches that feel different from any headache you have had before are another warning, known as thunderclap headaches when they strike suddenly and intensely. These can indicate bleeding in the brain or an artery under extreme pressure. Pain of this type, especially when combined with nausea or vomiting, should never be ignored. Weakness or numbness in the limbs is one of the classic stroke warnings. If you notice that one arm feels heavy, a leg will not respond properly, or your grip suddenly weakens, even for a short time, it must be taken seriously. Similarly, changes in the face, such as drooping on one side or an uneven smile, are urgent signals that blood flow is being disrupted. Speech problems complete the picture. If words suddenly come out slurred, if you cannot express yourself clearly, or if others cannot understand what you are saying, treat it as an emergency. These are not minor inconveniences. They are red flags that your brain is in crisis. Another overlooked sign is extreme fatigue. If you feel drained of energy without explanation, unable to perform basic tasks, or overcome by weakness, your brain may not be receiving enough oxygen and nutrients. When this fatigue appears suddenly and is unlike your usual tiredness, it must be viewed as a possible precursor to stroke. Each of these symptoms can fade quickly, but that does not mean the danger has passed. They are often caused by transient ischemic attacks, sometimes called mini-strokes, which are the body's strongest warning that a major stroke is coming soon. Treat every warning sign, no matter how brief, as a medical emergency. By paying attention and acting quickly, you can prevent a catastrophe that could otherwise change your life forever. 4. What to do when these symptoms appear. When the early warning signs of stroke appear, hesitation can cost you everything. The most important action is to treat every symptom, no matter how small or short-lived, as an emergency. Do not wait to see if it improves. Do not assume that rest will fix it. And do not attempt to diagnose it yourself. Time is brain. Every minute of delay means millions of brain cells are dying. And once they are gone, they do not come back. Immediate action is the only way to protect your future. The first and most critical step is to call emergency services right away. Do not try to drive yourself or ask someone to take you slowly to a clinic. Paramedics are trained to begin life-saving care on the way to the hospital and to transport you to a facility equipped to handle stroke. At the hospital, doctors will perform brain scans, such as CT or MRI, to determine whether the stroke is caused by a clot blocking an artery or by bleeding inside the brain. This distinction is vital because the treatments are completely different. A clot may be dissolved by special medications or removed through a procedure, but bleeding requires surgical or intensive medical management to stop the damage. Acting quickly can make the difference between full recovery and lifelong disability. There is what doctors call the golden window, usually 3 to 4.5 hours from the onset of symptoms. If treatment with clot-dissolving medication begins within this time, the chance of recovery is dramatically higher. Beyond that window, the brain damage often becomes permanent. This is why waiting at home or hoping the symptoms will pass is one of the most dangerous mistakes you can make. While waiting for emergency services, remain calm and keep the patient safe. Do not give food, drink, or medication unless instructed by medical professionals, as swallowing difficulties are common during stroke and can lead to choking. If the person becomes unconscious, place them on their side to keep the airway clear. Take note of the exact time the symptoms began, as doctors will use this information to determine eligibility for certain treatments. Share any history of blood pressure problems, diabetes, heart disease, or previous strokes with the medical team as soon as possible, since this guides their urgent decisions. Even if symptoms vanish completely after a few minutes, as in a transient ischemic attack, the danger has not passed. In fact, it is often at its peak. Research shows that many full strokes occur within days of such an episode. That is why every warning sign requires urgent evaluation in a hospital, even if the patient feels normal again. Remember that stroke does not only threaten life, it threatens independence, speech, memory, and dignity. Quick action gives you the best chance to preserve all of these. When in doubt, always act. Calling emergency services immediately is not overreacting. It is life-saving. Treat every symptom as your brain's final cry for help, and answer it without delay. 5. The golden hour of treatment. Doctors often refer to the first 60 minutes after the onset of stroke symptoms as the golden hour. This phrase is not an exaggeration. It reflects the critical reality that brain cells die rapidly when they are deprived of oxygen. And the sooner treatment begins, the greater the chance of survival and recovery. Every minute counts. During a stroke, blood flow to part of the brain is either blocked by a clot or disrupted by a burst vessel. Without blood, nerve cells begin to malfunction and die. By the end of 1 hour, millions of cells may be gone, and the networks they form may be permanently broken. Once destroyed, these cells cannot regenerate, which is why early treatment is the only way to preserve brain function. The golden hour matters because it is the period in which doctors can intervene most effectively. For ischemic stroke caused by a clot, medications known as clot busters can be administered through a vein. These drugs are designed to dissolve the clot and restore circulation before brain damage becomes irreversible. The effectiveness of these treatments drops sharply as time passes, which is why starting them within the first hour can mean the difference between walking out of the hospital or spending the rest of life in a wheelchair. For hemorrhagic stroke caused by bleeding, urgent steps are taken to control blood pressure, stop the bleeding, and relieve pressure on the brain. In some cases, surgery is required, and the sooner it is performed, the less damage accumulates. The golden hour is not only about medical treatment, it is about recognition and response from patients and families. Too many people lose valuable minutes because they do not realize that slurred speech, sudden weakness, or brief vision loss are emergencies. They wait, hoping the symptoms will fade. Or they waste time searching the internet instead of calling emergency services. By the time they arrive at the hospital, the golden hour has passed, and options are limited. This delay is one of the greatest barriers to saving lives. It is also important to remember that some hospitals are better prepared for stroke emergencies than others. Comprehensive stroke centers have specialized teams and equipment to deliver advanced treatments immediately. Emergency medical services are trained to identify stroke and take patients directly to these centers when possible. This is another reason why calling for professional help, rather than driving yourself, is critical. Paramedics can begin stabilizing you right away and ensure you reach the right facility without wasting precious time. The message of the golden hour is clear. Do not hesitate. Do not wait to see if you feel better. And do not downplay the seriousness of symptoms. The first hour is your window of hope. Act within it. And you give doctors the chance to reverse damage, restore function, and save your independence. Miss it, and the brain may pay a price that cannot be undone. When it comes to stroke, the golden hour truly decides the future. Doctor's final words. As a brain doctor, my closing message to you is urgent yet hopeful. Stroke is one of the leading causes of death and disability, but it is not a silent thief. In many cases, your body begins to sound the alarm days or even a week before the attack strikes. Dizziness, sudden vision changes, strange headaches, brief weakness, or slurred speech are not minor inconveniences. They are cries for help from your brain. Ignoring them is one of the most dangerous choices you can make. Acting on them, however, can save your life. The golden hour after stroke symptoms begin is your best chance for recovery. But the days before, when warning signs first appear, may be your only chance to prevent disaster entirely. This is why listening to your body and responding without delay is so essential. Do not dismiss unusual symptoms as fatigue or aging. If you experience them, seek urgent medical care, quick evaluation, brain scans, and targeted treatment can stop a transient ischemic attack from becoming a devastating stroke. Prevention is always more powerful than rescue. Controlling blood pressure, managing cholesterol and diabetes, quitting smoking, limiting alcohol, staying active, and eating a healthy diet all reduce the risks that create these emergencies in the first place. Yet even with prevention, awareness is your strongest defense. Recognizing the signs and acting immediately ensures that doctors can use every available tool to save your brain. I want you to think of this as a personal responsibility. Protecting your brain means protecting your speech, your memory, your independence, and the moments you share with those you love. Do not gamble with those treasures. If warning signs appear, act. If a stroke begins, call emergency services without hesitation. And if you have lived through a warning or an attack already, commit today to the changes that will reduce the chance of another. Now, I ask you directly, have you or someone you care about ever experienced sudden dizziness, blurred vision, or weakness that vanished quickly? Share your story in the comments. Your words could help another person recognize the danger and seek help before it is too late. Remember, stroke can steal everything in seconds. But awareness, action, and prevention can give you years of life, clarity, and strength. The choice is yours, and the time to act is now.